Million patient visits. The Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an Air Tamer Personal Air Purifier. It's easy to have filtered air with an Air Tamer Personal Air Purifier. An Air Tamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Air Tamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Air Tamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code Ageless Health and get a 10% discount. Order today.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Roselle. Hey everybody, Dr. Tom Roselle here, and you're listening to Dr. Tom Roselle live stream, Ageless Health. Sorry we had some technical stuff and we had to modify it for today's program. You'll forgive me. I'm really sorry that it's turned out this way, but nevertheless, I got some great information for you, and we're going to talk about what's really going on in your gut, in your intestinal tract, and it's just one of those things that nobody really wants to talk about. This Wednesday evening at the Roselle Center in Fairfax, we're going to be spending an evening on gastrointestinal problems and all the problems that it can manifest and come about. And I think that you're going to be very surprised at what we're talking about as far as symptoms and process things, joint pain, migraine, headaches. This all comes from your gut often, getting way too fat because you're not digesting things. The anemic processes that you have, whether it's an iron deficiency or B12 or other absorption problems, and even things psychologically, depression and bipolar and autism and Tourette's. And would you believe that your gut has the prime driver in so much of that? And it can come from things as simple as gluten and dairy, and we're going to talk about why, or other allergy reactions, what causes that. I get to do the program, just you and me, and we're going to have a lot of fun doing that this week. It's important that you have all the information that you need to turn things around. And we're going to try to get into that a little bit today. Hopefully you're still with me. And if not, you'll pick this up on the way back. But, when we talk about immunological reactions, there's a lot of articles that are being written, not only today and more of them, but also things in the past, except nobody has taken the time to do the exploration. Instead, we come up with commercials like exocrine pancreatic insufficiency. And my brain goes, what the hell is that? It's something that we've known about, insufficient production of enzymes in any organ system, throughout my career and even prior to that. But now they like to put in alphabet soup, EPI and all of this and everything else you come up with. It is somebody, patients come in and they say, well, did you hear about, XYTZ? And I look at them and say, what are you talking about? And they look at me like I should know all of this and everybody else should know all of this. And it's what I want you to understand. It's Fifth Avenue marketing. It's the way that the marketing guys out there put their advertising together to grab your attention, if you will, and get you to pay attention to what it is that they want to sell you. An insufficient enzyme production of any kind, whether it starts in the stomach or whether it starts in an organ system someplace because of something. And we're going to talk about what those some things are in just a minute, and some of the things that you can do to help yourself are simply a result of multidimensional things that happen to the body, injury patterns and ongoing psychological stress patterns, things that you absorb into your body from outside of your system. It can go even as far as, say, the chemtrails that you see on a daily basis up in the skies. What are those? Have you ever taken the time to really think about it? How about what we just went through with all the vaccines and the vaccines? Do you know that children today, by the time they're like 6 years old, if they follow the vaccine schedules, have about 70 different types of vaccines that were put into their body? That's abhorrent. I don't know about you, but when I sit back and say, what for? Why? And we're going to tell you some of the reasons why, and why you have to make a choice as far as your medical exposure or anti-medical exposure, or the things that are trying to kill you, or whatever it is. You've got to make that decision based on information. Going to the publications on the radio a few minutes ago, I talked about the article that came out in 2014. It was simply called "The Prevalence of Antibodies Against Wheat Milk Proteins, in blood donors and their contribution to neuroimmune reactivities. And that was in a journal called Nutrients, 2014. The article was written by three people, Vajodani, Karazian, and Mukherjee, and very, very well-known people in the neurobiochemical platform. And I would encourage you, if you're like me and you like to read things, it's written enough that you can read the abstract and the conclusion. Forget about all the stuff inside of it, and then see what you think. Make your own decisions. 70% of adults that have been diagnosed with schizophrenic patterns have gliadin antibodies at birth. Now, what does that mean? That means that they have gliadin reactivities, allergy reactivities at the time of birth. How did they get that? Well, they had to get it from their mother. So maternal antibodies to dietary irritations, we call them antigens, right, are passed through to the offspring. And they increase the risk of different types of psychosis in children as a result of what mom's been eating. So when you're my patient, one of the things that I do, we ask you the question, one, where did you live? Was there any health problems in your father or your mother? What was the dietary patterns about? Years ago, the medical community used to acknowledge that children that were born from mothers who smoked, and that was the 40s and the early 50s, had underweight expression when they were born. Kids were like 5.5 pounds, 6 pounds, and so forth, and was not at a good healthy place. So what you have to know is that gastrointestinal tract of yours, that bloating, that distension, the things that make you uncomfortable are not a drug insufficiency. They're a result of something going wrong in your body. Now, we talked about earlier that it starts in the mouth with mastication. That means the chewing of your food. And if you don't chew your food well, you're not producing the saliva, which has elements of gastrin and pepsin in it. Then it goes in your intestinal tract, your gut, your stomach, and then it triggers your stomach to produce higher levels of gastrin, pepsin, but also hydrochloric acid. So guess what? You need hydrochloric acid. And when you suppress the hydrochloric acid formation in your stomach, you're going to cause toxic reactions throughout your intestinal system. You're going to get bloating. You're going to get distension. You're going to get uncomfortableness. You're going to get a bad gallbladder production. Your pancreas is not going to work the way it's supposed to. Your microbiome, the good bacterium within your gut, is not going to be able to defend, protect, and produce the things that you need to have in your system. So when that takes place, now you have, this permeability. What does that mean? That means like you have a colander and it's not holding everything back long enough for it to break down and it's absorbing in your body, basically undigested. And those zonulin gatekeepers that, they're the guys that protect the absorption process. It can be too much or too little like anything else. They are disrupted by bad bacteria at that point. And so what takes place is that you have all of these people that are complaining about different types of increased sensitivities, bloating, distension, constipation, diarrhea, but it goes to the external portion of the body too, rashing in the skin, and a loss of colors. Vitiligo, loss of pigmentation, is a gut problem that often is correlated, directly related to mold and fungus and other bacterium that are there. So when we look at this a little deeper and we understand that it starts with foods and the things that we put on our foods, even if when we think that we're getting good foods, like we go to the fast food place and we're getting some chicken nuggets. Well, I ate chicken. Well, maybe you ate chicken, but you got a lot of carbohydrate called gluten surrounding it. And those things continue to break things down. The rice flour, the potato starch, the corn starch, the tapioca starch, all these things should be grain free 100% if you want your intestinal tract to heal. You know, patients will tell me, well, I'm doing the best I can. Well, what does that mean? I'm trying. Well, what does that mean? How often are you getting? Well, it's not as often as I used to. Trying to get somebody to be quantifiable, very difficult, because we know then we're going to expose our hand. And we have to understand that, you know, it's either you're doing it or you're not. There's no little bit. There's a little bit in training, meaning you're getting better at it, but you're not healing until you bite the bullet and you get it done, you stop the irritation. I use the metaphor often, a boxer's in the ring and he's taking body blows, body blows, body blows, body blows. And initially, they're able to withstand it. Then pretty soon, after they start beating on the arms, the opponent and the body and so forth, pretty soon they break down. And pretty soon that knockout punch comes. And that's what happens with the gut as well. If you don't give it the time to heal, the autoimmune reactions and the inflammation is still there. Does it drop a little bit? Maybe. But it's still interfering with the body's ability to heal. And it interferes with gene expression, and it disrupts your endocrine function, your intestinal tract. So the leaky gut phenomena, if you will, for what we call it, is the biggest indicator, finger pointer, that you have a bad intestinal system somewhere along the line. And it can often be a result of the exposure to way too many lectins. Lectins are protein, by the way. And by the way, if you eliminated all lectins, you probably wouldn't eat much of anything. However, these lectins can cause increased sensitivity to what? It can cause increased sensitivity to things that produce fatigue, tiredness, weakness, skin rashing all over your body, pain in any of the joint spaces, anywhere, swollen hands. It's known but for a long time, there's these little bumps that get on the distal portions of your fingers, right? They're called Heberden nodes. And it's a direct finger pointing to rheumatoid arthritis. Where does rheumatoid arthritis start? In the intestinal tract. So if you're going to deal with a rheumatoid problem, a rheumatoid arthritic condition that affects your body, you have to deal with the gut. So maybe if you just take your food and you soak it, if you help break down the outer core and let your body go after it just a little bit, something as simple as that often. Maybe, if you start acidifying your gut and getting rid of a lot of the junk that's there, do you think that might help? Well, the truth of it is, it will. If you stop exposing your body to glycophages, Roundup, and that's on virtually everything, if it's a genetically modified food source, you might take one step in the direction that you need to go. So what is known about glycophage? The central mechanism and how it affects its system is the disruption of your liver enzymes, your pancreatic enzymes. It leads to impaired bile flow from your gallbladder, and it causes vitamin D level to be low in your system. So you can take a lot of vitamin D and it still looks like it's low. It's because your liver and your gallbladder are not working the way it's supposed to. We have to understand that bloating, that putrefaction, is a result of system not working the way it's supposed to. It's not about suppressing the activity of other systems. It's not about putting an antibiotic in there. It's not about knocking it out with an anti-inflammatory. It's not about giving you a protein pump inhibitor to stop the production of hydrochloric acid in your stomach. It's about understanding that your body is not working the way it's supposed to because you got your finger in the mix and you're messing it up. So if that's the case, Don't we want to begin to understand enough that we can begin to turn things around? These exposures, these glycophosates in the environment, the Roundup, more commonly known, will cause damage to the red blood cells. It will cause low-grade swelling of your brain. It'll cause disruption within synthesis of certain important pathways of the body. We've all heard at this point the methylation cycle, right? Well, everybody's, that's off and running. That's the new buzzword, methylation cycle. Well, there's a lot of pieces of the puzzle of methylation. We know that the initial one that they found is something called MTHFR. And what that means is that you can't take folic acid and convert it into the active form to folate because there's something missing. The worse your intestinal system is, the worse that process becomes. And we can end up with high levels of NOS, which we know is a disruptive situation within the body, and we can't produce arginine, which is important in the production of nitrite or nitrates in the body. And so we can get into that whole pathway, but we really have to need to understand what really takes place. It's an important process. It's an important process. 75 to 80% of the tracked increase in autism. Remember, I said on the radio program that it used to be 1 in thousands first that were autistic spectrum. Now it's what? It's 1 in 36 to 38, depending on the author that you read. How can that be? How in God's name can we get that many kids that are born now on the spectrum? Could it be the adjuvants, the aluminum, the herbicides, the glycophates? Could it be those things because that's what's on the rise? And it's since 1988. That's not a long time ago. It's not a long time ago. 75 to 80% have increased to the level we are now since 1988. I don't know about you, but that gets me kind of rattled, right? But if we don't do something about it, we don't understand it. You can fix it, by the way. This is not something that's not reversible. This Wednesday evening, I'm going to get into it specifically. I'm going to show you what you can do. I'm going to show you how you can fix that bloating, that intestinal garbage that's going on. I'm going to tell you what happens with all that joint pain that's hurting and you lose motion and function. You can't get your spine to work the way it's supposed to anymore. That headache that just never wants to go away. More than 60% of all processed foods in the supermarket that are in the supermarket are processed. I'm sorry, more than 60% of all foods are processed. Pizzas and chips and cookies and ice cream and salad dressings and your corn syrups and, things like that. Baking powders even that you do your own stuff. Your oils, soybean, corn, canola, the worst things that you can put in your body. So when you get that, you understand it, that there's a real ongoing irritation and self-abuse pattern. Hear what I chose the word self-abuse. Self-abuse. Why is that? Because you're putting stuff in your system that innately shouldn't be there, and you're doing it anyway. That's self-abusive. So I'm the guy that's going to remind you that you got some options, that you can do things differently if you choose to. And we're going to do that Wednesday evening. Join me. We're going to have some fun with this. I promise you. I won't beat anybody up, but I'm going to do some demonstrations that you're going to get the idea that, oh my gosh, at least turn the light on a little bit, make you think a little differently. But I'm going to give you some things specifically you can do to help yourself and to make things better ongoing. If you go to drtomroselle.com and you go to the Ageless Health website or web store, the online store that we have there, there's a lot of things that you can look at. We have glutathione, which will decrease the inflammatory reaction. We've got, some bone broth soups that are there that are really excellent that you can help begin to do the transition. And we'll guide you through that. But you have to make sure that you know. See, if you know then you choose otherwise, then you got a problem. What happens if B12 doesn't get absorbed the way it's supposed to? Then you're going to end up with all kinds of little things. You're going to see that your red blood cells don't work the way it's supposed to. You're going to see that your homocysteine begins to rise. You're going to see that there's changes in your blood supply, vascular changes. You're going to see that there's plaquing that takes place. It'll affect your RNA and your DNA, and it decreases the protective wrapper around the uh, the nervous system, and it leads to neuropathy simply because of the things that we're talking about. But it starts in your gut. So that bloating, that distension that you think is coming from your gallbladder, that bloating and distension that you think is coming from your EPI, your exocrine pancreatic insufficiency, it can be fixed. It can be turned around. You just have to do it the right way. Wouldn't it be great to take control of your life? Or have we turned into such a weakened society that we're unwilling to take control of us? See, your body was made with everything. The body is the greatest pharmacy that has ever existed. It has everything you need. 90% of all cells and genetic material in the body come from the gut flora, your good guys, your good bacteria. And when we know that, and we look at what might be inhibiting and impairing it, is a problem. You have this area that we lovingly call the ileocecal valve. If you put your fingers on your hip, the front of your bone, that little bone that says some of you can't feel it because you've got too much around the center part, and you go to your belly button and you kind of draw a line between the two of them, there's something there called ileocecal valve. And on the other side, it's called the Histonian valve or the sigmoid reflex. And it's not a valve per se, like we think of valve of turning water on or off. It's really a little muscular ring. But when that is not competent, things will backflush into the system, and it can cause all kinds of things from diarrhea to constipation, but bloating and inflammation and distension and sore belly and backflushing of foods and make you feel like you want to throw up. And by the way, one of the primary signs of a bad gut, and when it's involved with the ileocecal valve, your mouth smells like a sewer. When you go up to somebody, they start talking to you and they smell like they, forgot to flush. Did I say that? Well, that's what it smells like, unfortunately. And yes, there's a problem. So as we age, the liver loses its ability to work properly because it's been irritated and its nutrient basis has been depleted. The number of the energy platforms, the little engines that could in the body, they're called mitochondria, they begin to break down. So the gut doesn't work the way it's supposed to. And then we begin to see more and more genetic variants because that's the outside exposures repetitively beating up on us. And your digestive enzymes, your hydrochloric acid, when they came out with EPI, exocrine and pancreatic insufficiency, I'm surprised that along with that, they didn't start with stomach insufficiency, hydrochloric acid insufficiency, because we've known that forever. And by the way, if you fix that first, sometimes the pancreas works better. And I'll tell you why that is this coming Wednesday evening. So join me. But there's things that you can do by, taking care of your body and getting rid of the junk, the modified food sources, drinking green tea, get a clean source of omega fatty acids in your body, using anti-inflammatories in your food like turmeric, using anti-aging substances like resveratrol, taking a little garlic because the allicin in the garlic will wipe out some of the bad guys. But it's not as a supplement, just make it part of your food choices. I'm the kid that grew up with a grandmother that, between a really clean homemade olive oil and, you know, the garlic that she had in the cellar and the fresh onions and so forth, we stayed pretty healthy. And even though we weren't perfect, we did things that we were supposed to. But here's how it works. There are things that causes the body to work. There's a substance called molybdenum that detoxifies things called sulfites. They're bad for you. And things called aldehydes. They're the byproduct of what? They're the byproduct of mold and fungus. It's an alcohol. And it supports all kinds of processes of the body. We talked about hydrochloric acid and certain enzymes. And then we want to make sure that we put out the fire with anti-inflammatories, glutathione. So there's a lot that you can do. And we're going to get into that this coming Wednesday evening. I promise you, you're going to learn a lot. It's going to be me and thee, and we're going to have some fun doing it. I'm going to talk to you about what blood tests and blood work and saliva testing is proper and what we can expect to find. We'll talk about something called a complete stool analysis, and we'll talk about good and bad bacteria and parasites and inflammatory markers. And we're going to talk about this thing called SIGA antibody reactions, immune support pattern in the body. We're going to talk about short chain fatty acids. And we're going to talk about this EPI craziness that's out there and why that's not the first step. And we're going to go through the blood work and tell you what you need to know about that and what to ask your doctors about. That's my thing. I want you to know. I want you to know. And to quote somebody who I have a tremendous amount of respect for, in today's world, it's not enough to know, but you have to know how and why. And that's what we're going to do. We're going to talk about that. We're going to talk about what the nervous system does, what its role plays, how it affects, these organ systems. Did you know that where your rib cage is, from the bottom of your neck all the way down to where your rib cage is, it affects all of your organs of reproduction? The liver and the stomach and the spleen and the intestinal tract and so forth. Did you know that? Well, we're going to show you that exactly. And then we're going to show you how to get rid of stuff, to remove things, to reduce the presence of them, restore function. And we're going to how to put the good guys back in, and then how to get that system to repair itself. Not just to put a Band-Aid on it, but to repair it. Can you turn things around? Well, I'm here to tell you that anything can be fixed. You just have to start the process the right way. And we're going to give you that opportunity. We're going to show you exactly what to do. So join me, okay? Coming up Wednesday evening, 6 p.m., Roselle Center for Healing in Fairfax. I promise you we're going to have some fun doing this. And it's just me and thee. And we're going to get into the depth of all this craziness. Go to drtomroselle.com and register for the class. And I'll be looking forward to seeing you. And remember, I do this every Sunday, and we're going to probably, hopefully, do it more often and send you smaller snippets. And we're going to put some courses on where you can really learn some things as well. And I do it for one reason only. I love you all. You deserve the truth. See you next week. Bye.